Okay, next question. Let's answer the next one. Ask, what's your opinion of somatic integration? That's a very interesting question. The thing is, I don't know what that is. I don't know what somatic integration is. Honestly, the method never really interested me. Well, I mean, there's also somatic integration, the Finkel's method, something like that. I haven't really studied what it is. But maybe I'm wrong. But the point is that a person takes a certain position, stays in it, and apparently something good happens while they hold it. But the thing is, people come to us for treatment. They have back pain, maybe a headache, or joint pain. And of course, they want us to relieve their pain as quickly as possible. That's what they want. And our job is to do that. That's why we chose from the methods that are already quite effective. Manual therapy, osteopathy, applied kinesiology, and reflex therapy. We chose what works, what we are good at, what gives quick and stable results. That's why we chose them. We started to apply them. The same goes for exercises. From the large range of exercises, we selected those that allow us to quickly restore muscles that aren't working. There are many different methods, but in my opinion, not many of them allow you to achieve quick and stable results. And our task is to do this in a short period of time, because people come to us for treatment and we can't experiment on them. When I was just starting out in manual therapy, when I didn't have any experience, that was when I had the chance to experiment. I worked at a clinic. There was a large flow of patients, and I had the opportunity to apply different techniques. I tried osteopathic techniques, applied kinesiology techniques, which that is the branch of applied kinesiology where the connection between an internal organ and a muscle is taken into account. For example, if the pectoralis major muscle wasn't working, we would manipulate the liver, and then I would see what worked and what didn't. I had the opportunity to really practice, you could say, but now I understand that there are a lot of techniques that people teach, and of course they have some effect, but it can be done better. And now what we think is more effective, that's what we use. If a new method appears, we look at it, evaluate it, and if it's worthwhile, we learn it and start using it. I don't consider somatic integration to be such a method. I don't think it's an effective method that can be used in treatment. You can experiment with it, of course. Next question. Could you please tell me? So, this is a question about some video, right? Could you please explain how you turn the oblique abdominal muscle back on and then off again for the demonstration at the 19th minute? I assume you turned it off by stretching its tendon and turned it on by stimulating its attachment point. That's right. That's correct. Okay, next question. What does it mean when all the vertebrae are normal and easy to feel, but in one spot on the lower back, there's a gap about the width of 2 fingers? First of all, it means you urgently need to go and get an X-ray. It might be nothing serious, or it could be a symptom of an underlying condition. So There's no need to guess. You need to see a doctor, get a diagnosis, have an x-ray done, and then you'll know for sure why you have that gap, the width of 2 fingers. Next question. What methods are there to deal with trigger points? Massage, shockwave therapy. There are quite a few ways to eliminate a trigger point. The simplest of these is direct manual pressure on the trigger point. There are methods that involve acupuncture, methods of dry needling, and also techniques where certain medications are injected, but the simplest, most convenient, and most accessible method is manual pressure with your hands. You can adjust the angle and the pressure. This way it's easy to affect the trigger point. There is also a way to treat trigger points using a special device, a percussor. It's also a very good method. But the downside is that this device is not sold in Russia, not sold in China, and you can only purchase it in the United States. If you watch videos of American chiropractors and manual therapists, many of them use a percussor. It's a device that looks like a big gun, and they use it specifically on trigger points. It's very convenient, but it's not sold anywhere. You can order it from China, but it will be something completely different. So they're quite, as it were, it has to be exactly.